Are you guys looking at that, of how we impact the health of the communities?
Yeah, so we really think about remote patient monitoring on a continuum. And when I think about the lowest touch of remote patient monitoring, it's the work that our community health workers are doing that are screening for social determinants of health. They're doing that digitally out in the communities that we serve and able to connect then those patients to community-based resources. We may not be able as a healthcare system to provide all of those things, but we certainly can build the network and the connection and the trust with those patients so that they do have that connection.
So those partnerships, does that fall under your part of the organization?
It does. It's kind of naturally gravitated towards that from the standpoint of, with the pandemic, really working with the state of Illinois on how we digitally can enable community health workers locally to get patients to the right resources. Whether in the beginning, that was really just the worried well and digitally texting with them and asynchronous visiting with them to calm their fears so that they didn't present to some of our locations when they didn't have a need to. And then really monitoring once disease was more prevalent in our communities with COVID, monitoring through pulse oximetry so they could stay in their homes and not have to be in a facility. Then just learning all of the social determinants of health, because with all of those, we embedded that screening. So then that forced us to really make those partnerships in the community to say, we've got to do something with this information. We can't just know that you have food insecurities. We have to figure out where the food pantries are, what churches are open on Saturday to get a family that really needs food this weekend when the food pantry is not open.
Yeah, that's fantastic.